Go ahead, ma'am.
Okay, so good afternoon, everyone, and welcome back. Because of some technical issues, we had to stop our session on thin endometrium in between. So we'll be continuing from here. In the previous session, as we were discussing about like post hysteroscopy, can a patient try naturally or move ahead with IUI before going ahead with the IVF treatment? So as we have seen that when any hysteroscopy procedure is done, the maximum effect of the hysteroscopy on the endometrial thickness and the vascularity lasts for a period of like 3 to 6 months. So in this period, the individual can try naturally or go ahead with IUI, but they require proper monitoring, in which the endometrial thickness needs to be monitored along with the growth of follicles. So if the endometrium is lagging behind in this case, we can support it with the in the form of estrogen, or the vascularity can be improved with the help of sildenafil medications. But in the monitoring, if the endometrial thickness is not improving or if it is remaining in the lower level, then it's always better to go ahead with IVF treatment. So here we can go ahead with IVF or ICSI cycle with a frozen embryo transfer, where we can give hormone replacement therapy in these individuals. So individuals who have a thin endometrium, and what are the modalities of treatment available to improve the endometrial thickness. We can give them estrogen supplements, estradiol valerate, up to a total dose of 16 milligram per day can be started in these individuals. Estrogen in various forms, in the form of vaginal estrogen, or estrogen gel that is available can be used to improve on the thickness of the endometrium. Estrogen along with GCSF injections, or platelet derived plasma, platelet derived rich plasma can be instilled into the endometrial cavity, or you can instill GCSF preparation or give GCSF subcutaneous injections. These will also kind of help in improving the endometrial thickness and the vascularity of the endometrium. We can start these individuals on aspirin supplementations. We can start them on low molecular weight heparin. All these modalities are kind of going to help in improving the blood flow to the endometrium. Naturally available supplements like L-arginine, can be started. L-arginine supplements can be started that can also help in improving the thickness as well as the vascularity of the endometrium. Um, there are other modalities of the treatment. Those are the recent advances in the form of PRP installation that we have discussed. So hysteroscopy guided PRP can be instilled into the endometrial cavity, or we have something known as the stem cells. Now here the bone marrow derived stem cell can be instilled into the endometrial cavity. Now these stem cells will help in improving the endometrial thickness, the pattern, and the vascularity of the endometrium. So these are the recent modalities of treatment. So definitely in individuals, with minimum estrogen supplement, if the endometrial thickness is not improving, or if the vascularity is compromised, these individuals can go ahead with an IVF cycle with a hormone replacement therapy induced frozen embryo transfer. So I think we have dealt with most of the options that are available in treating individuals with thin endometrium, and we have tried to cover how to approach an individual who comes with a thin endometrium, and what are the difficulties that these individuals or a couple per se faces during the treatment to attain pregnancy. So I think this is all that I have from my side. I hope this session has kind of being helpful in solving the queries, and getting to know this topic in a better way. So let us see if any questions or any queries are available from our viewers side. Okay, so the first question that's popping up is what causes thin endometrium? So, as we have already discussed in our session, estrogen is one of the main hormone that is responsible for increasing the thickness and the vascularity of the endometrium. So, conditions in which the estrogen is not there, like the individuals in whom the ovarian reserve is less, or the follicles are not growing at the right pace. So this can result like abnormal menstrual cycles, individuals with PCO, low ovarian reserve. These individuals individuals can have thin endometrium. Second thing is if the vascularity to the endometrium is compromised, or if the endometrium is damaged because some operative procedures like a curettage has been done in them, or they have undergone a myomectomy, or any fibroid operations has been done, or there is any form of pelvic inflammatory diseases or infections, previous history of infections like tuberculosis, chronic endometritis, or these individuals who are recurrently taking oral contraceptive pills. Now, this will basically cause a hormonal suppression and will not allow the endometrium to go at the right pace. Repeated ovulation induction with clomiphene citrate medications, or endometrium that is particularly of poor quality. These individuals will have a thin endometrium, or any form of infections that has resulted in adhesions in the endometrium. So this can result in thin endometrium. Okay, so coming to the next question is, what are the risks of thin endometrium? So as we have already seen that an endometrial thickness of at least 7 mm is necessary to attain a good pregnancy result. So endometrial thickness less than 7 mm, and particularly less than 6 mm, has shown to decrease the success of pregnancy. So chances of pregnancy kind of decline with the decrease in the endometrial thickness. And even if individuals with a thin endometrium do conceive, they are going to have problem in supporting the baby. So they're going to be increased chances of miscarriage. They're going to be placental abnormalities. So these individuals will have chances of growth retarded babies, low birth weight babies, preterm deliveries, or increased risk of hypertension in these individuals. Okay. So the next question is, can PCO cause thin endometrium? So as we have seen that ideally from the menstrual cycle day 2, your follicles are going to start growing, and when the follicles grow, they secrete a hormone that is known as estrogen, and this estrogen is going to act upon the endometrium and increase the thickness of it. So when in PCO individuals, they have irregular menstrual cycles, their follicles are not growing at the right pace, and therefore in individuals with PCO, they can have thin endometrium. Okay. So the next question is, how can I improve my thin endometrium? So coming to the natural remedies, asparagus, clover oil, or supplements of vitamin E, L-arginine, regular exercises, meditation, Ayurvedic treatment in the form of acupuncture or fertility massages. This can help in improving your endometrial thickness. Next comes your therapeutic modalities. You can supplement it with estrogen. We have other options available, that we can go ahead with a hysteroscopy procedure to know what causes the thin endometrium, and we can ideally treat the factors that are responsible for thin endometrium. We have advanced treatment like we can go ahead with GCSF injections, PRP installations, or stem cell therapy that can help in improving the endometrial thickness. To improve the vascularity component, we have options such as low molecular weight heparin, sildenafil, low dose aspirin. So these are all the modalities that are available. Okay. Next question is, can I get pregnant with thin endometrium? Definitely, you can get pregnant with thin endometrium, but we will try to attain an endometrial thickness of at least 7 mm. If it is less, so there are increased chances of miscarriage or increased chances of complications later on in your pregnancy. So by going ahead with the estrogen supplements or the other modalities to improve the thickness of endometrium, or going ahead with an IVF cycle with a hormone replacement therapy where we have adequate time to improve the endometrial thickness. In that, we can go ahead with estrogen supplements. We can go ahead with PRP installations. We can go ahead with stem cell therapy, or you can add in the sildenafil. You can add in the blood thinners like the aspirin, the low molecular weight heparin. So definitely we can attain pregnancy with an endometrium, but you need to continue the support so that the pregnancy is maintained further. Okay, so I think this is all that we have for today. So thank you everyone for your patient listening, and I hope this session was helpful in some way or the other. So if you have any queries that are related to this topic, or if any help is needed from us, you can dial the helpline number that is given below, or you can reach us physically at any of our two centers, that is Oasis Fertility at Kaspate Vasti at Vakad or Arisa Avenue at Karadi. Thank you.